My name is Dorothy Agala. I work for KISWA. And I give Global Health Promise consent to use my video on the social media and even the website. I want to talk of our partnership with Global Health Promise since 2019. When we first met Brian and he came to Kisumu, we did some interviews on maternal health of mothers, what happened to the sex workers who are mothers when they are pregnant, when they give birth, and the life of their children. And in this one study, we were shocked to see the number of deaths of women within the last 5 to 6 months. It was very high and it was really shocking, and majority of them was due to unsafe abortion. We have continued with our partnership, and in 2022 again we did another survey on food security. And again, when Brian is here this week, we were sharing the preliminary result of this study. We are again shocked with the number of deaths that are coming from our region, Kisumu. It's contributing almost to 2/3 of the deaths of sex workers in Kenya. Especially when we look at the murder, a lot of sex workers, around over 100 sex workers were murdered, were reported to be murdered by fellow sex workers. 55 of them died out of unsafe abortion, and around 80 something were on issues of HIV related, where we know the issue of food security also affect people's adherence on ARVs. Most of sex workers reported stopping from taking medication due to lack of food, and they could not continue with their medication. So most of them stopped taking medication, and so they lost their lives. This also contributed to quite a number of women dying in Kisumu. In our visits at the hotspot for the past 3 days, we've realized that the sex workers are struggling feeding their children, with most of them reporting their children having only 1 meal per day. If they go far, they can have 2 meals in a day. They are really struggling, and they expressed that in the past 2 years, the life has continued to be harder than what was there in 2022 when Global Health Promise visited. So it's again getting tougher for them, and that most of them cannot feed their children. In our visits at the hotspot with the mothers, we also come to meet one of the moms who had double challenge because she has a child with leprosy, palsy, and the child is disabled. The child is 2 years old and cannot sit, has to be supported, and she's also doing sex work. So it's very difficult for her. Nobody wants to live with the child, remain with the child when she's going for her work. So it's making her so much vulnerable to a lot of issues, including violence, and she's really struggling to bring this child up. Again, she's very much pregnant at 9 months term. So it's really difficult. She's just 19-year-old with a child with disability and another pregnancy. It's very hard for her, and she really needs to be supported. We really appreciate Global Health support for the intervention they are doing with the sex workers who are mothers and their children. Thank you.
Would you like to talk about the business we have developed for this young woman, for the young mother?
So we sat down with the young mom
This is the mom who has a child with a disability, and she's 9 months pregnant.
She's 9 months pregnant, and she suggested if we can support her have alternative business, that is cosmetology. We looked at the items she's looking for. We made a visit to some shops, similar shops that she would want to have, and we visited one of the shops in the mall, in the shopping centers, and she really is happy, and she would want to have such a space because she has the skills to do the same on hairdressing and making pedicure and manicure. So through Global Health Promise, we are going to help her through the economic empowerment project to bring up this business, and KISWA as an organization will help her and support her in supervising and ensuring that the business stands and runs, so that she can be able to take care of the child with disability and even the unborn child that she's expecting, because the disabled child has to go for physiotherapy, thrice a week, which it requires some money, which is difficult on her, and she doesn't have any source of income except for sex work. Yeah, so she was happy. She went with us round, and she was happy to see the kind of shop that Global Health Promise to the economic empowerment program would suggest to bring up for her. Yeah.
Thank you.
Thank you.